discuss the next, that is 6th episode of Phatak Materia Medica live series. Today's remedy is acetic acidicum. So let's start with acetic acidicum from Phatak Materia Medica, decoding the acetic acidicum. So according to Phatak, acetic acid is a profound debilitant remedy. Marked debility in this remedy, like other acid group remedies. So Phatak describes it. It acts on mainly blood, nutrition and assimilation, serous membrane and vital force. This is not a remedy for mild weakness. This is a remedy for life-threatening exhaustion or life-threatening weakness, where in few days or few months the patient's life may be in danger. So that type of weakness in the acetic acidicum. Phatak especially highlights on profound anemia, excessive emaciation, dropsy and anasarca, hemorrhages with collapse. More highlights 4 clinical pictures we common see in practice: severe anemia, excessive emaciation, dropsy and anasarca, hemorrhages with collapse. So these 4 clinical condition may you found in liver cirrhosis, malnutrition, severe anemia or cachexia, tuberculosis. These main type of clinically oriented diagnostic diseases can we see in the acetic acid. So main core of the acetic acid or essence of the acetic acid is life is draining faster than it can be restored. Means that the patient's vital force or life or his body system is draining so fast that but the body cannot restore it. Blood is fewer, nutrition is failing, strength is collapsing. 3 things: blood is poor, nutrition is failing, strength is collapsing. Patients looks pale, waxen, transparent, exhausted. Male paleness is the waxen look is the characteristic of acetic acid with exhaustion. Acetic acid is the remedy for exhaustion beyond repair unless helped. The sentence is very much important. The acetic acid is remedy have exhaustion beyond repair unless it help, and it is helped by homeopathic remedy, that is acetic acidicum. Mental picture is of acetic acid is not dramatic but deeply worried patient. Key indications that grievances with about sickness, worries about children, anxiety about business and failure, borrows trouble, forgetful, may not recognize his own children's. So 2-3 things are in deep pathological condition. We may see that forgetfulness of recent events or he cannot recognize his own children's, and anxiety about business and future. So commonly seen in if a case of liver cirrhosis with severe anemia, anasarca, and the mentally patient is exhausted and he forgetful for many things and even does not recognize his old children. In OPD, you may listen that, "Doctor, I know I am getting worse. I can't stop thinking about it." Means he is constantly thinking about his own complaints. This is mental weakness due to physical collapse, not due to hysteria, as in we can see in Valerina or in Ignatia. Physical generals that as already I have said that profound debility, frequent fainting, breathlessness, weak heart action. Patient looks much sicker than the diagnosis suggested. Fluid losses, profuse urination, profuse sweating, vomiting after eating. This is loss of fluid leading to the collapse, as we need to compare this with China. Thirst and appetite. No thirst in fever, intense thirst in dropsy, cold drinks disagrees. Characteristic symptoms in dropsy or liver cirrhosis that patient have an intense thirst as other acids have in thirst. Key contradiction is thirst varies with pathology. Means this remedy has constant thirst symptom is not there. The thirst symptom varies with this pathology. Particular symptoms and keynotes regarding the particular organs is face pale, waxy, emaciated. Pale, waxy and emaciated. Left cheek red during fever. In stomach symptoms, burning, pain in stomach and chest, followed by coldness and cold sweat, vomiting of all kind of food, cancer of stomach or ulcers in the stomach. Food, bread and butter disagrees, vegetable disagrees except potatoes. Abdomen, tympanic, ascites, chronic diarrhea in emaciated children, urinary complaints, large quantity of pale urine, diabetes with gas, thirst and debility. In female complaints, metrorrhagia after delivery with great thirst, threatening breast abscesses, milk thin, bluish, slower, babies fail to thrive, marasmus, skin and fever complaints, burning and dry skin, diminished sensitivity, hectic fever, profuse cold night sweat. So, in modern day today's era, the patients comes with bunch of investigations and files with visiting the modern medicine consultant, and they have often we see in the reports and diagnosis that patient have severe anemia, cachexia, low all muscle wasting, chronic kidney diseases with edema or malignancy related or cancer related wasting, chronic diarrhea with malnutrition, or ulcerative colitis or gastric ulcer, stomach ulcer with blood loss. Then again congestive heart failure with dropsy, and main pathological condition that in that I use acetic acid in oftenly is ascites, liver cirrhosis with ascites, in which acetic acid works like a magic, reducing the fluids in the abdomen. We have to differentiate with the 2 or 3 remedies for ascites, that is Aesculus hip, second is acetic acid, third is Lactea spicata, and fourth is Apocynon can. And you need these are the small remedies or remedies related to organ, and big remedies like Lycopodium, arsenic album, Apis mellifica. In investigation, you may show that low hemoglobin, low albumin, patient need to infuse the albumin or globulin many a times, electrolyte imbalance. These are the clinical indications or reports that we may see. In acetic acid, systemic in failure, and the system is in failure and organ is going to failure, means first time system is failed, then organ is failing. So, some comparative remedies, I has already told you that the first remedies come to mind is China. China has both have common symptoms of debility after fluid loss, but China have more flatulence, more hypersensitivity. Hypersensitivity is marked in China with flatulence. Acetic acid has weakness, waxen pallor, dropsy and collapse, more collapse seen in acetic acid. In collapse after hemorrhage, China comes first, acetic acid comes later. Acetic acid, another remedy we can compare acetic acid with is arsenic album. Both have weakness and restlessness, but differentiating point is arsenic have more anxiety, burning pains better by heat. Acetic acid has collapse, cold sweat and no anxiety. Another remedy which is very close to acetic acid is carbovage. Both have common features of collapse, but carbovage wants fresh air and bluish face, while or with much flatulence, while acetic acid have waxy pallor, emaciation and dropsy. So, as in Phatak Materia Medica, he gives us a remedy relationship and sequelae in at the end of this remedy is the remedy related or follows well that remedy. So he gives that China uh, acetic acid follows China after hemorrhages. Uh, then second remedy he explained that arsenic album with anxiety develops and carbovage in terminal collapse. That's both the about three remedies are morely related or follows well after the acetic acid, or we have to see compare the picture clinical state and decide when to give acetic acid, where to give China, where to give arsenic album, where to give carbovage, so that we can clearly differentiate each remedy. Then after seeing the remedy relationship, we have to give another remedy if needed alternately, not giving first remedy response, then we have to seek for the another remedy. So clinical sequence as seen as early told in the after excessive blood or fluid loss, we have to give first China. If patient don't respond, we have to go to the acetic acid. So some of the common type of patient come in our clinic, and they tells us some things that I want to explain you that uh, patient says that doctor, I feel extremely weak, I am losing weight day by day, I sweat a lot even without fever, I am feeling faint, breathless and pale. These are the common versions of patients that we can see in day to day practice. Or and then we have to differentiate it is just anemia or only weakness or in deep pathology or in a constitutional collapse. So after investigation, proper case taking, we have to point out to acetic acid or arsenic album China, these remedies come to our mind. When life is draining out drop by drop, think of acetic acid. So this is now I have giving you a common prescribing totality of acetic acid, that is 6 to 7 symptoms that is characteristic of acetic acid, and we never miss these symptoms in our day to day practice. Extreme pallor, waxy face, rapid emaciation, profuse losses, blood, urine, sweat, vomiting, dropsy and anasarca due to any reason, but characteristic symptoms may match. Weak heart with breathlessness, mental worry with forgetfulness. So in few lines we can describe acetic acid is when strength disappears faster than the disease progresses, think of acetic acid. So common mistakes we do while prescribing acetic acid, when there is strength is preserved, acetic acid fails. No emaciation or no dropsy, acetic acid fails. This remedy suits collapse state, not in early diseases. So while using potencies, I generally use 30 potency, frequent repetition in all the cases, especially in liver cirrhosis and ascites. Very few cases I use 200. In severe pathological cases, I use acetic acid 6C. 6C and 30 is the commonly used potencies in our clinic. In severe ascites or severe dropsy, I use 6C 4 or 5 times a day. Then response gets patient getting better, then I will shift to the acetic acid 30 2 times or 1 times a day, followed by constitutional remedy, or if needed a liver remedy or a organ remedy that suits for the patient. So this is the all about acetic acid. So core of the acetic acid or final words for that I can say in 2 or 3 words, acetic acid is waxy, exhausted and draining. Acetic acid reminds us the life force is bleaking away, acts wisely. No, not every anemia needs iron, some needs understanding. So this is about the what I want to discuss you about the acetic acid. Thank you for patience listening. We will join in next series tomorrow. Thank you very much.